How you feeling?
I'm feeling good.
Yeah.
Yeah, the nap on the plane revived
Fresh
me.
off a flight.
Yeah, fresh off a flight. I changed in the bathroom. I
I
got
was gonna
ready.
ask, like, what was your routine like getting off the flight and then getting ready for here? Like, that was fast.
Well, I have a specific airport fit, so I usually wear my like Fabletics sweatsuits and
So you're
stuff.
ready to go.
Yeah,
Okay.
yeah.
And then
So
you
it's
just
like
hopped on the
hitting.
plane.
Yeah,
I picked you up.
yeah,
We're here now.
yes,
Super fast.
yes.
Oh man. Thank you for doing this. I really appreciate it. Yeah.
Of course.
You're not like
I love
starving or
doing this
anything.
stuff. No, I'm okay. I'm going to dinner after this.
Oh, perfect. Where are
Yeah.
you going?
Um,
Hold you over.
Beatrix.
Oh yeah. Okay, in
Yeah.
West Loop?
Um,
Or which one?
we're going to River North.
Okay.
Yeah.
How's that one? I don't think I've been to that one before.
I don't think I've been to that one either. I've been to the one in West Loop before.
I like that
but
one.
Yeah.
What are you gonna order?
I have no idea. I have not looked at the menu. I forgot what even is the menu. My friend is like fully gluten free, so I'm usually like, you pick. I'll work with whatever. We eat pretty similar foods anyway, so
Mm-hmm. What are you
it's like it's
craving?
okay. What am I craving?
Yeah.
Oh, I mean, I always crave sushi, but I don't think
Asian
they
food.
have that. Yeah.
Mm-hmm.
I don't know. It'll
Do they have
depend.
sushi? I don't think
I
that.
don't
Yeah.
think so. I don't even remember what they have, honestly,
Hmm.
but I'm sure I'll get some type of chicken-based dish or whatnot.
What's your second favorite food besides Asian food?
Mediterranean. I love anything Mediterranean. Yeah.
Such as?
I mean, Greek food is a little different. I mean, there's so many different types of meals, but anything that has like vegetables and rices and some type of meat. Usually my go-to meat is like beef, lamb, or chicken.
No pork.
No pork.
Never.
No, never. I
Never
don't know
any
the
pork.
last time I ate pork.
When was the last time you ate
It
pork?
probably was like, what am I, 27?
Man.
At least 15 years ago.
Okay.
Yeah.
What'd you think of it? You just didn't like it? It just right away.
So I used to eat turkey bacon, well, actual bacon, and then I turned to turkey bacon, but this was like middle school, high school. But I would pick it apart because I hated the fat. Like I don't like
The fat.
my
Okay.
yeah. I would pick it apart, so I would only eat the red part.
Okay.
Yeah, yeah. So
Sure.
then at that point, it's like, what are you eating for?
What's
There's
even the
no
point of this?
There's
Yeah.
no point.
Yeah.
Yeah.
I feel you. I don't love pork. I think I told you on the car ride over.
Yeah.
It's like beef, chicken, and then pork's kind of way down here too.
Yeah.
But
Sure.
yeah. Should probably get into some physical therapy
Yeah.
stuff here. We're going to keep all that in, by the way. Yeah. But this is Art of Wellness episode 6. Thank you for subscribing. Thank you for listening. We got Dr. Melanie here. What's up? How are you? How are you?
Pretty good.
Yeah.
Yeah. Yeah.
But lots of PT talk today. So
Yes.
I have an outline
love it.
that I always say I'll look at, and I probably won't, but hopefully we will hit most of this stuff. Very physical therapy heavy podcast, and which is something we both love.
Yeah.
Right?
I
That's
do
why
love
we
the
got into
profession.
Yes.
Yes.
Yeah. What's your favorite part of the profession?
Mm.
I'm already going off topic.
No,
by the
you're
way.
good. You're good. Go off topic. It doesn't matter. My favorite part of the profession, I think, is the like diversity aspect of what we can treat and do. Like I
Mhm.
think there's so much to the profession, and a lot of people think it's like one thing. Like I had one patient that literally was like, I thought PT was only for like post surgeries. And I was like, oh, that hurt my heart because there's so much more that we do and can treat and see and whatnot. So just our scope.
Our scope.
Our scope.
I was gonna say that too because we're
Yeah.
we can do a lot of things. We
Yeah,
can work at
so much.
hospitals, schools, nursing homes, professional sports teams, private practice like myself.
Yeah.
We're so diverse, and people think we're massage therapists
Oh my gosh.
or personal trainers.
Yes.
And that's one of our biggest pet peeves, right?
Mhm.
How often do you get
Yeah.
that?
You know, I haven't gotten it as much recently.
Mm-hmm.
2-3 clinics ago.
Okay.
I had this like younger, he was probably like 18, and he was like, I've never had my own personal trainer before. And I was like, physical therapist before. But,
PT, yep.
yeah.
It gets very
Yeah.
convoluted.
But settings for sure. But I
Yep.
also think like the actual diagnoses is also huge. Like what we can treat. Like I
Yes.
feel like everyone just thinks knees, shoulders, hips, like are the bigger joints and areas of the body. But like we can treat, pelvic floor constipation, other things, and concussions and
Mhm.
dizziness and headaches.
Yep. I
So,
mean, we're very diverse in our
yeah.
what we can treat, and it's school is rigorous.
Yes.
But I wanted to start with like, where did your love of physical therapy come from? Was it during undergrad?
No,
Okay.
before in high school, actually.
Okay, so you're
Yeah.
way earlier than I was. Okay,
Yeah.
so go ahead and tell us that
Yes.
story.
So, do you swear on this podcast?
Fuck yeah.
Okay. I didn't remember. And I was like, I don't know how professional you want to be.
No, you're good.
Okay.
We're
So,
chilling.
in high school, I took an anatomy and physiology class junior year. And I originally actually was into graphic design. Like, that's the route I thought I was going
Oh.
to take.
Mhm.
I've always been really into like the arts and just creative things.
Mhm.
And then
There goes my phone. Go ahead, I'm listening.
And then I took anatomy and physiology, and I was like, what the fuck? The human body is actually insane.
Mhm.
And I
Oh,
fell in love
okay.
with the human body
Yeah.
and just like learning anatomy and physiology.
Mhm.
And I was like, what can I do with this? I didn't want to go to medical school because I did not want to be a medical doctor.
Okay.
I've always been very like intuitive, and I've been thinking about it more recently, but I've always been into like holistic health and more like
Mhm.
natural ways of treating things.
Mhm.
So I was like, I don't care about pharmacology. That's not the area of medicine I want to go into. And then I just kind of, I don't know, thought of PT, and I was like, I like this. This sounds really cool, and it's a lot of anatomy for sure. So,
Okay,
yeah.
so you loved anatomy then,
I
right
did.
away.
I loved anatomy. And actually, my friends that were just visiting, we were talking about high school, and she was like, I remember you like were ranting about anatomy to me and how much you loved it. And then she's like a very much English brain,
Yeah.
not as much like the science.
Mhm.
And she was like,
Oh, I see.
and she took it because I loved it so much.
Mhm.
And she was like, what the fuck? Like, I can't do this. But yeah.
Yeah.
So,
I think for me, like, I think it was a junior at North Central. Yeah, I was a junior. I was taking all like the science classes. I didn't know if I want to do med school, pharmacy, what other, health profession there is. But
yeah.
I think once I learned that physical therapy can be more like active, holistic, like you said,
Yeah.
it definitely like gravitated towards me. So I shadowed them. I loved the clinics. I loved working with those types of people. It was super fun for me. And then I fell in love with it. So that's what kind of brought me there. But it was a lot later for me than for you.
So what did you major in when going into college?
Exercise science.
Okay.
So what was
That's
your major?
fair. Kinesiology.
Yeah, same thing.
Yeah. But I was like, I have a set plan, and I like every semester would like write out all the classes I was going to take and my plan for everything because I wanted to graduate early too.
Oh.
And so, yeah.
Yeah. So you did all that then?
I did.
Wow. Where'd you go to undergrad?
Miami of Ohio.
Oh, cool.
Yeah.
How was that?
It was good. I have no regrets. I liked it.
Okay.
But,
Sounds like a deeper story there.
I mean, it's a very white school. Like, it's predominantly white.
Yeah.
And with that, like, I come from the city, inner city of Chicago. So diversity was definitely lacking.
And you're Greek and...
Greek and black.
Okay.
Yes.
I'm Mexican. We're very diverse on this podcast here. So, yeah.
So that was like a cult. Also, it's in the middle of nowhere. So, like, huge culture shock.
Yeah, it is. Yeah.
Yes. It was very different than what I was used to. So... I found my people, but yeah, it was
not fun, huh?
It was fun. It was very fun. You have to find your people.
Yes.
And that's the biggest thing.
And you found them.
Yeah. Yeah.
That's good.
Yeah.
And then you graduated early, you said?
Yes, a semester early. Yeah.
And then did you go to PT school after that, right afterwards?
Right after.
And you went where again?
Northwestern.
Northwestern, that's right.
Yeah.
Okay, cool. And how was that overall? Is that 2.5 years? Like,
yeah, pretty much.
I went to the University of Iowa, so we were 2.5 years too.
Yeah, probably the same
Similar.
timeline.
I like the fast
I do too.
pace of it too.
Yeah.
It was, tough, but
very tough.
very tough.
Might as well get it done. Yeah,
that's what I always
sooner
thought.
Than later. Yeah.
How was first semester for you? Because first semester for me was the toughest.
Yeah. We actually talked about this on my podcast.
Okay. Which is what again?
It is the Physio Diaries.
Mm-hmm.
Okay.
Great podcast.
Yes. Yes, go check it out.
We fully endorse it here in the Art of Wellness podcast. Yep.
But first semester, first year, it literally felt like the only thing I did was study and party. It was like you studied,
you partied
you
a lot.
partied, you
Okay.
studied, you partied,
Yeah.
and that was it. And yes, we were
Okay.
very much. My friend group, I guess, was more of the going out crowd.
Yeah, for sure.
And so yeah, it was. Yeah,
Do you think
it
every
was tough.
semester was just as tough as the previous one?
No, I think the first year was the hardest.
I think so too.
Yeah,
Yeah, I've heard
it's
that a
just
lot.
such a shock in your like routine, mentality, everything. I remember sitting in bed being like, do I want to fucking do this?
Yeah,
like,
man.
is this really what I want to do? Is this
It's
really
a
for
lot.
me?
Mhm.
Yeah, it was a lot. But once you get into clinicals, then you're like, okay, I remember why I want to do this. But also, not all clinicals obviously are not the same.
Right.
All settings are not the same.
Yep.
So some clinicals, I was like, yeah, I definitely can't do that. Other clinicals, I was like, okay, I like this.
Yeah.
So,
You said hospital clinicals were not for you, right?
yes.
Can you explain
not
why?
an acute care girl.
Mm-hmm.
It is not for me. I can't. It's like sensory overload.
Okay.
Do you ever get that when you're in the hospitals?
Well, I was telling you, I work PRN at the hospital by me. So that's, I'm there like twice a month at most.
Yeah.
I guess I do. Yeah. But I don't know.
I guess since you're
It
not
doesn't
really
get
there
to-
that much,
Maybe that's
that
why,
it's
yeah.
like you don't really think about it as much.
Sure. Yeah.
But I don't know. I got sensory overload in my acute care clinical.
Okay.
Just all the sounds, all the smells, all the everything, all the
Mhm.
lines and tubes. I was like, it's too much.
Yes. Lots of smells.
Yeah.
Lots of
Yeah.
stuff going on. It's a hospital, it's hustle and bustle. There's a lot of stuff
Yeah.
going on.
Yeah.
Ton of different patients. I mean, people sick. When I was there 2 weeks ago, lots of hip fractures from the ice and everything around here. Hip fractures, a lot of flu and stuff still. But
That's fair.
it wasn't like
It's such a different way of treatment
Yeah.
too. Like it's just making sure they're safe.
safe, get them moving.
Yeah.
Which is
What
good.
was you had an acute care clinical?
Yes, my which one was it? I think it was my first clinical was at U Chicago in Hyde
Okay,
Park. And it was
okay.
acute care there.
Nice.
And I think like you initially, I was like, I wasn't gonna like it, but I like the team aspect sometimes
Okay.
of the healthcare team. Like we're all working
That's
together
fair.
for the patient. Like
Yeah.
I walk in, the nurse comes in, the MD comes in. We're all there like trying to like see what's going on, game planning for the patient.
Yeah,
I
that's
thought
fair.
that was kind of cool. And honestly, I would love to replicate that for my private practice soon, obviously. But
Yeah.
so I like that part of the health of a hospital, working at the hospital.
Yeah.
But it was different for me because I'm more of a sporty guy. I like working with athletes, and I've grown to appreciate the hospital setting, I think. But yeah, but PT school was rough. I think for me too, the initial shock of first semester was like a lot of anatomy, a lot of kinesiology, just like no life for a while.
No, literally no life. Yeah.
No life, lots of studying. The first few tests were rough for me. But then once you get the hang of it, I was like, oh, okay. Like, I get it now. I know what they want from me. You learn kind of your system of studying how to get things done. I think they try to weed out a lot of people in the first
For
semester.
sure.
Yeah.
Well, okay, actually, that's interesting.
Mhm.
Did your school have people that dropped out after the first semester?
I think we had 2 or 3.
Okay. Because I've
Did
heard
you?
some schools after the first year, mine, we did not have anyone that dropped out. There was one person that just like paused and then came back the following year.
Mhm.
But Northwestern really did try like hard to keep people and not like have people leave. Like there was different systems they had in place for that. But yeah, I've heard of
Yeah.
other schools though that have like are bad with like their
Oh, yeah. Yeah, no, we
Yeah.
weren't bad. I think one person, he was just like married, had kids. It was like a second career for him. So he just
Okay.
kind of just left.
yeah.
I think it might have just been that person now that I think about it. But
Okay. Well, then, yeah, that's not bad.
how
That's
big
not
was your
bad.
class?
92.
92. That's
Yeah.
big. Ours was 40.
Okay. Yeah.
And it dropped
It's
down
like
to 39,
normal.
38.
Yeah, I feel like
92 is not even that
50.
big. Okay.
Yeah, it's like normal, but Northwestern had the biggest class I'd ever seen.
Okay.
Yeah.
Yeah.
I feel like most schools are like 50, 60.
Yeah. Yeah, I would say
So.
so. Did you like that like bigger class environment?
Yeah, actually, I did. I didn't mind it. I never really like thought about it too much.
Yeah.
Yeah. We had a
Okay.
lot of faculty and we had a lot of different like teams and whatnot. So yeah, it was okay.
Were you guys very cliquey and stuff?
Yes, very clicky. With a class that big, like very clicky.
Yeah.
Yeah, there was the distinct front of the room, the distinct back of the room,
Mm-hmm.
and then the inner cliques from outside, like outside of school.
Yeah.
Yeah,
I'm trying to remember like how we were too. Because you graduated what?
2023.
2023. Okay.
Yeah,
I graduated in late 16, December 16. So I think it's
2016.
yeah.
Okay.
So I was thinking 17 because I started working 17 like soon after that. So
Okay.
I'm always thinking
Yeah.
like, did I graduate 2017? But it was actually December 16.
Oh, okay.
Um,
I see.
did you guys graduate in the summer or
Spring in
spring?
April.
April. Okay.
Mhm.
Did you take the big test right afterwards?
Oh yeah, I took it in April. Actually, we graduated, and the week after was the April board exam. Yeah. So I have heard schools that do it differently, but we had to have a certain GPA to be able to take it in April.
Okay.
But most of the class, I think it was a certain GPA. There was like a certain criteria,
Mm-hmm.
but most of the class like had that criteria. And I think half of us took April, half of us took July.
Yeah.
But our last clinical ended like the last week of March. And so me and my roommate, also my co-host on my podcast, we
Yeah.
both took it in
Mhm.
April together. We were actually living together at the time, so we
Mhm.
like studied together for it. But it was a grind.
Yeah.
Yeah, I really didn't study during clinical, and I
Mhm.
like crammed 4 weeks.
Wow.
Yeah, I'm a crammer.
You're a crammer?
I'm a crammer.
I think I would. I think I am too sometimes. Well, in PT school, I had to like not cram as much, but
That's
if
fair.
needed, I can cram.
Yeah, yeah.
But how was the test overall for you?
I thought I failed.
As I think everybody does.
Yeah. I got out of it, and I was like, I don't even know, like, what am I going to do if I fail? At this point, I already had my job secured and I was going to start my first travel contract
Yep.
in June.
Yep.
So I was like, fuck, if I fail, like, I'm going to have to extend that and I won't be able to start working. And like, I need the money to start working.
Mhm.
And I was like, I just can't fail. But I felt like I failed. And I don't know if it was for you, but we took it on a Thursday.
I don't remember.
It was like right before the weekend.
okay.
And that
I
entire
think
weekend.
it was for me. Yep. Mhm.
That entire weekend, I was
Just
in bed
stressing
watching
out.
Grey's Anatomy, just like down, depressed. Like, yeah, I couldn't do
So you
shit
thought
that
you
weekend.
failed
I
then,
thought
for
I
sure.
failed. Yeah, for sure.
I had a different experience. I didn't think
Really?
it was
Oh my God, tell
like I was
me.
one of the few people from my class. I think that because I took it. I took it soon after too. But I remember vividly the first two questions were super hard for me.
Yes.
And then at that moment, I was like, "Oh, I'm gonna fail.
Yeah.
This is it." Like I did all that school for no reason, all that money. It was. I thinking about it now, it's so crazy because like in
Yeah.
that moment, I remember the shock of those two questions.
Mm.
But shortly after that, it got easier and easier for me, and I was like, "Oh, okay, I got this."
Yeah.
And I finished it super fast, and I walked
Wow.
out, and I was like, "Oh, I for sure aced." I don't know why. Maybe just I was so nervous the first two questions.
Yeah.
Maybe like once my mind cleared. I mean, stress can just play tricks on you. You know.
Yeah. A lot of mind games during
Yes,
those exams.
but I tell students now all the time is like that information's in your head somewhere. You just gotta like pull it out. Like we all
Yeah.
learn the same stuff, the same rigorous schedule, all the same areas of study. It's in there, and they prepare you for the MPTE to pass that
They
specific
do.
test.
Yeah.
But yeah, I think even once I got into the flow of taking the test and like what kind of questions they wanted, like looking back on the practice test I took, I was like, oh, I know what they want from this question.
Mm-hmm.
I got in the flow of it, and I was like, oh, this isn't bad at all. So I think it's it's a
Did
big.
you pass the first time?
Oh yeah.
Okay.
Yeah. I think. Did you?
Yes. Yes.
Okay, but we're all nervous about it when we graduate,
Yeah.
but I don't think it's as scary as it seems. If you
Then PT.
scary as in like when we graduate, everybody's so scared to take it. I'm saying, but I
Oh.
don't think it's that scary. If
That's
you don't make
fair.
it that scary, as long as you again study,
Mm-hmm.
whatever in books. I forgot the books that they're
Yeah.
called.
There's so many.
I think I used what is it? The
Oh my gosh.
O'Sullivans or
I
something.
don't know. I never
Therapy
heard of that
Ed.
one.
Therapy Ed.
Oh, did I use Therapy Ed? I did use Therapy Ed.
And those tests were way harder for me.
Yes.
Yeah,
Oh
you
my
know what I'm
gosh.
talking about.
Yes. Therapy Ed. There's score. No. I don't.
Score builders.
Yeah,
Yeah,
score
that
builders
one
is
too.
one.
Those two. Yeah.
Yes.
That's all you really need.
Yeah. Those ones
That's
were
all I
hard.
did.
Oh my
The
gosh.
Therapy Ed ones were super hard, and I was
Yeah.
like, "Oh, I'm gonna fail again."
Did you take a lot of practice tests?
I took 3.
Okay.
I think.
Okay.
What about you?
I think I took 6.
Dang.
I was like
Yeah.
studying the exams.
Okay.
Yeah.
Yeah. No, the therapy ed ones I failed, like the first 2 that I took.
Yeah,
And the last
same.
one I barely passed. And I
Yeah.
was like, this is gonna be impossible.
Yeah.
But those questions were way more dense and way more like detailed.
Yeah.
Where the MPT ones were more like half of that. And there's always like 2 answers that weren't even like they're just so dumb. Like,
For
no,
sure.
those can't be right.
Yeah.
And then just 2 more answers you could pick from, and you just pick the one that
Yeah.
pick your first instinct, as I always say.
Mhm.
So you thought you were gonna fail. You didn't
Yes,
fail.
I didn't fail.
Good.
I didn't. Yes.
So and you started working soon after, you said, right?
Yeah, so the April board exam was at the end of the month, so I took all of May off and then I started the first week of June. Yeah.
And how was that starting to work? Did you feel like people always say imposter syndrome, right? Did you feel that right away?
I don't think I did that much. There were certain things I was very confident about, and other things I was like, I don't know. But actually, there was one therapist in the clinic I was at, and she had made a comment to me that just like always stuck with me. But obviously, I was a new grad, like fresh new grad doing travel, and she was like, "Oh, you're a new grad? You are like seems so confident." And I was like, "Thank you. I am. Like, should I
Yeah.
not be confident?
Right.
Like, what do you want me to be? Like
Yep.
a nervous new grad?
Yep.
Like, what?" And so, yeah, that always stuck with me. But I do feel imposter syndrome at times, but I would not say I regularly feel that.
Okay.
Yeah. Or I guess at that time.
Yeah. Did you have
Not
that
anymore.
recently at all?
No.
No.
Mm-mm.
Do you have an experience where you remember in your head, like, oh, I definitely had imposter syndrome at this time that you remember offhand, like a patient you had or something?
Yes, there was. This was a vestibular case.
Okay, yeah.
And honestly, the most that I've like had to really rethink things was more of like vestibular cases that are not like the standard. But now I've had so many freaking vestibular cases that now I'm like, I feel confident.
Yeah.
But yeah, this was at the first place.
Gotcha.
And there was definitely red flags, but it was like, I don't know. Her presentation, everything did not make any sense. And so, also not a great historian.
Oh,
And like,
one of those.
yeah, one of those. And also like symptom presentation was all over the place. Things didn't add up. So then I was like, okay, I need other people to like see her and check this out because I feel like I don't know what I'm doing.
Yeah. And you had mentors and stuff there to help you out?
To an extent.
Yeah.
Yeah. Like there was one person that I felt like I could always rely on.
Okay.
And then other people like here and there, like you could always talk to, but yeah.
Okay. We should probably backtrack a little bit. So, because
Yes.
travel therapy, I don't think people even know what that is.
Yes.
So can you
good point.
tell the people what travel physical therapy,
yes,
what it involves?
So pretty much it is a similar idea to travel nursing. It just is the physical therapy version. So it could be in any setting or most settings. So acute care, inpatient, outpatient. And I think a lot of times people don't realize you could be an outpatient travel physical therapist.
I don't think I knew that either. Yeah.
Yeah. And I don't think it originally started that way. I think it originally started as more acute care sniff, like
that's how I thought of it. Yep.
Yes. But now it's really like outpatient travel PT is definitely blowing up.
Okay.
But every 3 months, contracts are always for 3 months, and then you can choose to extend if you want to or if the need is there. But yeah, so, but I am an internal travel physical therapist, so there's internal and external. So with internal, I stick with one company. So I just go to their clinics and it's a lot more stable. Like I actually have a salary on top of like my travel stipend and there's like I have access to all the CEUs, the benefits, everything. It's like a normal, I guess, employee, not as much contract. But external travel physical therapy is more contract. So like you don't really get, I mean, you can get the benefits if you want, but like most likely you're going to be switching companies, recruiters, all the things. So yeah.
Got it. All right.
Yeah.
And then vestibular.
Yes.
Population. Can you describe that for people that don't even know what that is probably?
Yes. So vestibular is anything having to do with your inner ear and like balance centers, equilibrium. A lot of times like vertigo is just one diagnosis within the vestibular system, but like there's a vestibular hypofunction. There's you can have both sides affected as well. There's central nervous system involvement, so like brain, spinal cord, or any of like cranial nerve pathways that can be affected.
Mm-hmm.
And I do like treating neuro. So now at clinics, I feel like I always get thrown the neuro and
Oh, yeah.
vestibular.
Mm-hmm.
Yeah, but I like treating them because they're just like fun and different. And concussion overlaps with that as well. So a
I was
lot of
gonna say,
times
yep.
I always say concussion and vestibular are treated like almost the same.
Yes. Okay. I remember
Yeah.
at my old clinic, I did a few concussions. So I'm probably not as well versed as you are in it, but I was okay at it. And I
Yeah,
thought it
it's
was fun.
tricky. It's very tricky.
It's tricky.
And
Yeah.
the presentations, like you can have someone who's like, I'm fine, I just get a little dizzy
Right.
with turning. And then the person who literally can't walk for like 5
Mhm.
minutes because their whole body shuts down.
Yeah.
So there's just such a wide range. And I think that's the hardest part with
Yeah.
that.
I think that was fun though. I mean, I like concussions. It was fun treating them. Also, we're gonna say, yeah. I mean, healthcare involves a lot of stuff, like
Yeah.
us saying we love treating concussions and seeing all these different diagnoses, but and it is. I mean, it's a passion for us to help these people. So,
Yeah.
but yeah. So that's your first job now, right?
Yes.
That's your only job you've ever had.
Yes, yes.
I worked outpatient at a general clinic around here, whatever. We call them me and Rami call them the Taco Bell of physical therapy
Oh my
clinics.
gosh, yeah.
I mean, they're all like chain clinics. They're all,
Yes.
cookie cutter
Yeah.
corporate clinics, right?
Yeah.
And again, I told you, talking to you earlier, like as a new grad, it's fine. You learn super fast, all this experience all at once. You see a ton of patients all at once during the week. It's fine. It's fun. But then it starts to wear on you.
Mhm.
The corporate infrastructure starts to like bog you
Yeah.
down.
Mm-hmm.
And then that's when I was like, I don't know, was this like 3 years in, 4 years in? I don't remember when I left that job, but
Because you stuck with the same company?
yes.
Okay.
Yeah, that I worked there like straight out of school. Because I
Okay.
was there before PT school as an aide. So they
Oh,
kind of
okay.
just like,
Gotcha.
I was already
Yeah.
kind of shoot in there
That's
anyway. It was close to home. It was
Yeah.
fine. I knew everybody there. It was
Yeah.
fine. But the clinic itself is fine. It's just when the corporate hierarchy starts making demands of you, and they're like, "Oh, make sure you bill this much. Make sure you do this."
Or see this many people in this
Yeah,
amount of
and
time.
they start to say it in these legal terms that are borderline unethical, and we're not dumb. Like
Yeah.
we know we can see through their bullshit, And after a while, I was like, okay, like you just want me to bill more for more money.
Yep. Yeah. It's
Health
all about
insurance.
like it's a business at the end of the day.
Yeah,
So
but I hate that term when people say healthcare is a business. It is, but
well,
we should
they make it like
they
the
make
corporate
it-
PT world makes it.
the spectrum of
Yes.
helping people to making it a business should not be
Yes.
more on the business side,
Yes,
I think.
for sure.
And I mean, the healthcare industry is a hot topic nowadays, right
Yes.
now even. And we
Yeah.
know firsthand how much it's annoying, and it sucks for people getting denied claims.
Yeah.
Um,
Insurance is a bitch to deal with.
yeah, and I don't
Yeah.
deal with that anymore, thankfully.
Yeah.
So
Do you have any like regrets of leaving sooner, or
you mean
do
like
you
should I have
feel-
left sooner?
yeah?
Or
Do you ever think about that?
I
Or
think
you
it
feel
was.
like you left at a good time?
I think I told you like everything happens for a reason. I think
Yeah.
that was a good
Yeah.
time
that's
for me
fair.
to step away from
Okay,
it. I
yeah.
was still relatively young enough to be like, okay, I'm good. I know where I'm at in the PT clinical world. Like I had some
Yeah.
experience. I wasn't like super good yet, but I think I was good enough to start my own thing, which I did,
Yeah.
thankfully. And now it's all cash based, no insurance stuff. They could
So
all,
many people are
Yeah.
just switching over that now.
yeah.
Yeah.
Is that something you want to do?
Yes, definitely down
Okay.
down the line.
Mm-hmm.
I still want to take advantage of the travel perks for now.
Mm-hmm.
But once I stop traveling, I want to do my own thing. Like I don't think I can go from travel to being like full time at a normal like yeah,
Mm-mm.
no.
No,
No.
no, I don't advise it. But and then you told me dry needling is one
Yes.
thing you want to take,
Yes.
which
Yeah.
is fun. We love dry needling.
Yeah. Every state has like different rules. So I actually was
yeah.
supposed to take it last year,
Mm-hmm.
but since I'm in Florida right now, you can't like you have to be 2 years out of school. So I like couldn't
Oh,
even practice it if I got it. So I was like, I'll just do it this year.
Yeah. I
Yeah.
know in New York they still can't dry needle.
Oh,
According
New
to one of my
York
friends,
doesn't?
no.
I know California doesn't.
Okay, okay.
I
So
didn't
they
know
don't
New
get-
York, though.
No, my friend told me they
Interesting.
can't dry needle
Oh,
there either, and she's
interesting.
a pelvic floor PT too.
Oh, gotcha.
But yeah, interesting. So California can't either.
Yeah.
Okay.
But yeah, so many states have different rules. Georgia, they don't care.
That tracks.
Yeah.
So dry needling. What else are you certified in?
Pelvic floor.
Pelvic floor.
Mhm.
What else have you taken courses wise?
Concussion, vestibular.
Yep.
Mhm. Yeah.
Got it.
And then, yeah, pelvic floor level 1 certified. Yeah. So that means more of like incontinence, prolapse, constipation, but like we do internal exams.
That's what I was going to ask. Is that what the first course, you do that right away?
Yep.
Okay. What's an internal exam for people that don't know?
So it is very different than a gynecological exam. Okay.
Mhm.
That is always what I start with. It is pretty much just like palpating any muscle, right? Like if you have neck pain, you want to feel what the tone feels like and whatnot. So it's just the same thing internally.
Mhm.
So obviously we use a ton of lubricant and we make it as comfortable as possible. It's not like your legs are in stirrups. Absolutely not. But then we go in vaginally. Rectally is like the later courses, so we don't do rectally
Okay,
in level
that's what I was
1.
going to ask about. Okay.
And I don't think I care to get that certification. I think you
Gotcha.
can learn what you need to vaginally.
Yes.
But the pelvic floor has 3 layers to it.
Mhm.
And within each layer, there's, like 3 different muscles and whatnot. So if you look at your finger,
Mhm.
each knuckle is the layers. So layer 1, layer 2, layer 3. And layer 3 is like your biggest, the levator ani, and
Mhm.
the bigger muscles.
Mhm.
And so we're also like feeling for muscle contractions and like
Yep.
if people can properly perform pelvic floor contraction, aka Kegel, but a lot of people don't do it correctly. And also the relaxation phase is just as important. But we're feeling for
Yeah.
tone and pain. Like technically it shouldn't be painful.
Right.
So if it is painful, there's more tone into that
Mhm.
muscle, which can cause issues and
Mhm.
is a sign of pelvic floor dysfunction.
Yeah. Pelvic floor is super cool. I think I'm
Yeah.
going to take that class in the summer, the first
Yeah.
one. So I can't wait for that either. But definitely a population that I think is definitely growing in PT.
Yeah.
We see it all over social media too, pelvic floor stuff.
For sure. And I mean, it relates to so much, like the bigger picture of things. And also the pelvic floor world has developed so much within the past like 5 to 10 years, because I feel like it started off as a lot of manual and a lot of like you're always doing internal stuff, which is technically not what we want or what we're trained to do now. So like we want to get to functional as quickly as possible.
Mhm.
So like if I have pelvic floor patients, like we are not doing internal every single session.
Yeah.
Yeah,
it just depends. Right?
Yeah.
It depends.
Yes.
Is the main answer for everything in physical
Yes.
therapy, even like medical related. It depends on the patient.
Yeah.
What's your favorite? Is neuro your favorite
No.
population to treat? Okay, what's your favorite population to treat then?
Population. I don't know if I have a specific population.
Mhm.
Well, I guess more like diagnoses.
Okay, sure.
Yeah.
Yeah.
So I really like Parkinson's.
Okay.
I love treating Parkinson's, and they're
Mhm.
just so fun. I do like concussions. I love anything foot and ankle.
Oh, really?
Yeah.
That's probably my least
I like
favorite.
don't have a foot fetish, but like I just love treating the foot
Sounds
and
like
ankle. It's just so fun to me. Like it's so interesting and so overlooked. I like the shoulder.
Shoulder's cool.
Yeah. And pelvic floor. But
Pelvic floor.
specifically, I guess like vaginismus and like pelvic pain.
Throwing out all these terms that we don't know,
Yes.
Melanie. What's
Yes.
vaginismus?
So pretty much just like internal pelvic pain. So there's like different areas, like vulvodynia is more the outside sensitivity. There's a little more like neuro involvement, but then more internally like pain with sex and penetration, that is a pelvic floor diagnosis and dysfunction. So I like to treat that. Yeah.
It's just her smile when saying that. I like to treat that. Okay, so shoulder you said too.
Yeah.
Cervical stuff?
No.
Neck? Okay.
I actually hate treating cervical.
Really?
Well, I
Okay.
shouldn't say hate, but I don't like, that's probably my least favorite.
Okay.
Yeah.
So any like cervical radiculopathy type stuff, which is pain referring down, nerve type sensations down the arm. Okay.
Yeah.
None of that.
Not my fave. I mean, I do it all the time, but there's a lot of the times what I see is a huge psychological component as well. And a lot of times, like, it's really the chronic pain that gets me because there's always so many factors involved,
Mhm.
and a lot of people need other help outside of physical therapy that don't get it. So it's just a lot more challenging.
Yeah, elaborate on
Yeah.
that. I like that. Yeah.
Well, if it's more chronic, usually, like, I literally have had patients be like, I've had this pain for 10 years. And I'm like, oh, yikes. Like, that's so much harder to treat. And even the tolerance to any activity,
Mm,
the pain science, having like them understand that like PT is not going to fix 10 years of pain in like 2 sessions, and like their perception of pain is also different.
timelines. Yeah.
Yes, timelines, their perception. A lot of times stress and anxiety plays a huge
There you go.
role.
Yep.
So like even talking to people in terms of stress management can be so hard, because it's like, well, I have 4 kids and I work and
I
I do
know.
this
Yeah.
and that and I care for my
Mhm.
parents. And it's like, well, shit, like that's hard. And like, I'm not going to tell you not to do these things that's stressing you out and whatnot. So like getting some maybe other therapy would be
Yeah.
beneficial.
Yeah.
But also talking to people about that can be really hard, because then
Yep.
they're like dismissive. Oh, I don't have time for that. Or like,
Right.
I don't know, I'll see.
Yeah.
It gets
Yeah.
tricky.
Pain. I mean, there's a lot of overlap with physical pain and mental pain. I always tell
Yes.
people, I've referred people to, other mental health experts that I know within the Naperville, Bolingbrook area,
Yeah.
if needed, but, it's a touchy subject, but,
Mhm.
patients always tell me a lot of things too. So, like,
Yeah,
in a way, we're kind
for
of their
sure.
therapists, both in a way. It's
Mhm.
kind of the joke between physical therapists is patients tell us a lot of things.
Oh, yes. Oh, yeah.
So many things.
To unload their whole life and trauma.
Which is fine. Like,
Yeah.
I'm more than happy to listen, especially now that I
Yes.
work for myself. I have much more time to actually listen to people and sit there. An eval I had today, an evaluation I had today was like 30 minutes of talking.
Yeah.
We didn't do a lot of hands-on work. It was a lot of lifestyle modifications, a lot of talking,
Yes.
a lot of kind of reframing her ideas of pain.
Yeah.
She's had back pain for 3. Okay, I'm gonna start bad mouthing other professions here. I'm not gonna name any professions, but she's had back pain for 3 years, seeing X other practitioner,
Yes.
which you probably know who I'm talking
Right.
about. Oh my God.
Yeah.
And the stuff they were doing was essentially nothing.
Yeah.
They were just doing
Like
so they were
no
doing
exercise.
no exercise at all.
Yeah.
She didn't know how to do a pelvic tilt, activate her
Oh,
abdominals, any of that stuff. I was like,
yikes.
did I not teach you this in 3 years of going to this
This,
person?
yeah.
And she's like,
Wow.
no.
That's so
I was like,
unfortunate.
oh man. But I'm glad you're here now, is what I told her.
Yes.
She was very happy. End of session.
Yeah.
But essentially, they would just do back cracking stuff, e-stim, soft tissue work, leave. That was it. Just and get out of the clinic for 3 years.
And that's a story we hear a lot.
Yeah.
Yeah.
And I was like, oh, well, that's why you have back pain for 3 years, because
Yeah.
that's only one
You're
part of the equation.
not actually treating it.
Yeah. Do we even really, I mean, yes, it feels good. I get it. It's more of a short-term relief,
Yes.
manual therapy, all that
Yes.
stuff, hands-on stuff. Patients love it. I'm more than happy to do it. Am I going to do it for a whole session? No. They need active therapy, right? Which is reinforcing their lifestyle habits, empowering the patient to do stuff on their own, which is what a medical professional should be doing, instead of like being, no, you have to come here and get adjusted every week or whatever, insert whatever flashy treatment you want. So my first session with her today was, again, a lot of talking about being more active with her treatment, less hands-on stuff, a lot of lifestyle modifications too, a lot of talking.
Yeah.
And instead of me doing stuff to the patient, it was us working as a team.
Yeah.
And to me, that is
how it should be.
Right,
Yeah.
is what healthcare is. Instead of like, oh, fix me with a pill or a crack or something,
Yeah.
And, but she'll do great. And like you said, she's had that pain for a long time. It's hard to rewire the nervous system. It takes a little bit longer to desensitize all that, pain science stuff that I'll do another episode on probably. So, so I told her, like, it's not going to be fixed in one session, but that's okay. Your nervous system is very malleable too. It might take a little bit longer, but we can relearn things and unlearn your pain.
A lot of education.
But I love doing it. It's fun.
Wait, do you have favorite like area to treat, like diagnosis?
I love back pain.
Really?
Yeah,
Well,
I
that's
love
good.
back pain.
Yeah.
Yeah, I mean, it's so, like you said, biopsychosocial too. I mean,
Yes.
well, any pain is really, but like back pain for some reason is just
Yeah,
some
for
people,
sure the most.
as I'm sure we've talked about this or you've seen this on social media, like, MRIs, x-rays doesn't always correlate to
Yeah.
pain, right? So like I've had patients that they get an MRI, nothing's there, but they have crazy pain, or vice versa.
Yes.
Um, Maybe they have like little pain, but they get an MRI and it's like a huge disc bulge or something, and
Yeah.
and it magnifies their pain. They start getting scared, and
Yeah. And
all
then
that
they try
stuff.
like don't move as much and
Yes, and
yeah.
then that's a whole nother thing to kind of
Yeah.
relearn. But I love back pain. Well, I don't love it, but I love treating it.
Yes, treating
Is
it.
what we mean.
Yes.
Because the age range. I mean, everybody gets back pain.
Yeah. Everyone.
I forgot who said it. One of my instructors said it's the common cold of musculoskeletal
Ooh,
disorders.
that's a
It's
good
such a
one. I like
common
that.
thing, right?
Yeah.
And I've seen like 12-year-olds with back pain to like the 6 year. The,
Right.
the rage is so big. Everybody
Yeah.
gets it. That's the thing I treat the most. Honestly, is just back pain,
Okay. Yeah.
sciatica type stuff.
Yeah.
So I love that. Back pain, knee pain. I get a lot of
Okay.
ACLs still. It's a long road for them, but I like treating the more athletic population in my
Yeah,
practice.
for
It's
sure.
more like sports PT.
Mhm.
So they're always fun to work with, like younger athletic
Yeah,
population. So
totally.
I would say I love back pain and knee pain.
Okay.
My least favorite is probably foot and ankle. I don't mind it
Really?
either, but I don't know. It's
Yeah.
just kind of the lower you go, it's like I don't really like the treating those body parts. But
That's
neck pain, I
funny.
don't mind. Shoulder pain is fine too. Back pain is cool. Knee pain is fine.
What do you think about elbow? The elbow
Oh
pain.
yeah, I got some elbow people
Okay.
yesterday. I don't mind it. Yeah,
Yeah.
yeah. Do you get a lot of those?
Honestly, no. I
No,
really don't. I have not treated that many like elbow diagnoses. So, like,
golfer's elbow,
yeah, if
stuff like
anything,
that.
like lateral
That up kind of.
epicondylitis, but
Yep, yep.
that's really it. Yeah.
Your dream scenario is also like having your own thing, your own cash practice in
Yeah.
Houston.
Maybe Houston.
Maybe
Right,
Houston.
right now it's at the top of the list.
Hmm.
But yes, definitely having my own. Yeah, down the
Eh,
line.
what structure do you see for it? Like, what populations do you want to treat? What's your vision for
Oh,
it?
yeah. I go back and forth, I guess, with the vision, because I also love the interdisciplinary like approach.
Hmm.
So I guess it like in a dream world, I would love to have a business that had like PT, dietetics, nutrition, um, like a DO or more like naturopathic
Hmm.
medicine doctor,
Yep.
and then like yoga classes, Pilates, like
Yeah.
workout classes, and like group fitness classes.
Like all under one roof
Yes,
type,
all
like
under one
wellness
roof, and
center
like a
type.
cafe.
Okay.
Yeah,
Sure. Yeah.
yeah,
Cafe. Yeah.
yeah,
I mean, I
with
have.
like actually good foods and
Yeah.
juices and
Yeah.
yeah.
I have a similar vision. I want to make it more like a sports performance type thing, like
Mm.
the rehab side of things, strength and conditioning, and then nutrition,
Yeah,
dietetics. Like
yeah.
a maybe some sort of kitchen, all under one roof.
Mm.
For athletes, I love combat athletes. So like fighters,
Okay,
boxers,
gotcha,
Muay Thai people, Jiu-Jitsu people.
gotcha. Nice.
Maybe for them, but
Yeah,
anybody in the sports world, I love treating. So
that's fair.
similar visions. Yeah,
Yeah,
I want all in one area for patients. That'd be super cool for me.
yeah.
Um, let's talk about like so doctors, right? You mentioned
Okay.
you're not a medical doctor, right?
Yes.
So what do you think about us calling ourselves doctors? People are like, "Oh, well, are you not a real
Mm,
doctor maybe, right? Or what kind of doctor are
yes.
you?" What do you
Yes.
think about that?
I think that anyone who has their doctorate should be able to call themselves doctor in that profession.
That's it.
Yeah,
We're doctors in
we're
physical
doctors.
therapy.
Yeah, we're
That's our
doctors in
area of
physical
being
therapy.
of doctors
Yeah.
in PT. I
Hmm.
also say we're the doctors of movement and exercise because
Yes.
nobody else is.
Yes. For
That's
sure. Yeah,
that's
I
our
like say
thing.
movement specialist too sometimes. And yeah,
And
doctors of movement
exercise fits under that umbrella.
for
So we're
sure.
well versed in both of those things.
Yes.
So we shouldn't be shy, PT students listening to
Yes.
this, about calling ourselves
Yes.
doctors because we are very well versed in our area of
Mhm.
this specific medical field, which is
Yeah.
movement,
Yeah.
exercise.
I mean, no other medical profession gets the
No,
knowledge and education that we get and can treat the things we treat. Like there's yeah.
And I think we should be getting more attention because people are going more towards the holistic side
Yes.
of healthcare,
Yeah.
instead of resorting to pills, prescription stuff, surgeries, unnecessary surgeries. We're the gap in between that. Like someone has back pain and then they jump to pills or surgery.
Yeah.
I still get the odd patient that's like their primary care told them like, oh, go see this surgeon, or instead of trying PT first, they refer
Always do
them.
that.
Yeah, where we should be the buffer in between them. If we see red flags, like you said,
Yeah.
where we feel they need or we know they need some sort of imaging, like MRI, an X-ray, whatever, we'll send them. We'll refer them.
Like,
And
if it's not adding up, then it's out
yeah,
of our scope,
yep.
probably.
I know specialists in the area
Yeah.
surgeons that I could text and be like, hey, take this person. They're not presenting in a way that I can help right now, that you probably need to see them.
Yeah.
But if it's, back pain with no red flags, we'll take care of it
Yeah.
without pills, without, anything drastic. Right.
Mhm.
And I think patients and people these days appreciate that. What they don't appreciate sometimes is, like you said, the timeline, because it does take work to get out of pain.
It is a lot of effort. And also I think the perception with medical doctors, like they try to tell people like, oh, surgery is going to fix this. You're going to be totally fine right after.
Yeah.
Or like this medication is going to fix you.
Yeah.
And so people then automatically just want that like instant gratification, easy fix.
Yep.
And it's like, it doesn't work like that.
Nope.
Like,
Nothing in life works like that. So
No.
you shouldn't expect those results. Anything in life worth having, it takes some work,
yeah.
especially getting out of pain. And I always say physical therapy is just like any therapy. It's a process. We have to go through it. There's ups and downs, and that's okay. But you'd be surprised. Some patients just respond right away too.
Yes, for sure.
I had somebody get better like in 2 weeks from ankle pain, and it's like, oh, okay, you're fine. Here's your exercises.
Yeah.
Check in with me. That's fine. But most of the time, pain is up and down for people, and we're there to guide them through it. But misconceptions about PT, like we talked about us being called personal trainers, massage therapists. What other misconceptions are there about us?
I think the biggest thing I see is that people don't know that we treat certain things. Like, like I said, I think a lot of people just assume it's like for back pain, or if you're having surgery, or even like prehab is a whole nother thing.
Yeah.
But people don't know that we're doctors.
Right.
Have our doctorate. Misconception.
Do you go by Dr. Melanie?
In the clinic? In the clinic, no.
No. You should.
Yeah. I guess I've thought about it, but like, I don't know. I've never seen any. Well, some patients, if they know, they'll say doctor.
Right.
But I don't like introduce myself as like Dr. Melanie Ziaziaris. But like if they know, then
there's no reason not to either. I'm saying
that's fair.
But just because no one else is doing it, I mean,
did you? At your
I do
other
more
job?
now, a lot more.
Yeah.
And maybe you're still,
Yeah.
Well, I did. I think my second year started to a little bit.
Okay.
Because one of my mentors at that clinic would always tell me the same thing. He's like, don't be shy about it. Like, you have your doctorate. Say, hey, I'm Dr. Jerry. I'm Dr. whatever.
Yeah, that's a good point. I'm going to start doing that now.
Yeah.
I'm going to do it.
I do it now. I don't obviously say hey, I'm the doctor here. I'm just like, if I email them, I put Dr.
Oh,
Jerry
for sure. I'll always do that.
Introduce myself at first that way too.
Yeah.
But they don't have to call me that. I don't really care. I'm Jerry, your physical therapist. So other misconceptions about us.
Yes. What are you?
I'm trying to think. Well, I think the big ones, like I said, is, well, I guess these are more pet peeves. Like people just think we massage people.
Oh my gosh. Yeah.
Man, what's when you do manual on people or soft tissue stuff, like how long do you do it for? Like I go 10, 15 minutes. Max.
Yeah, for sure. Same. I am not a manual based therapist. Like manual, I will only do for very certain things. Not everyone gets manual, and I don't think everybody needs manual. So yeah.
Completely agree.
Yeah.
Yeah, I've treated patients barely touching them half the time. Like today, the evaluation today, I didn't even really, I palpated some stuff, looked around. But it was mostly, 45 minutes of talking and going through some motions that she never learned before.
Like foundational things.
Movement-based foundational things that people should know.
Yeah.
What else? Misconceptions.
Oh, I don't know. I feel like we said everything that comes to my mind.
Yeah. Yeah, definitely. We're not massage therapists.
No.
If anything, we're veering away
Yes.
towards more active treatment.
Definitely. Do you use e-stim or TENS?
No.
Okay.
I don't have
Yeah,
that.
absolutely not.
Ultrasound?
Oh my God, absolutely not. No, I barely even see that in clinics anymore.
Right,
Which is
yeah.
great because for what?
For what?
Yeah.
That's it.
Yeah.
For what? I don't have that. I don't have ultrasound. I don't have Well, I use e-stim with dry needling sometimes.
Okay. Well,
Sometimes.
that's
But
fair.
I don't know.
Yeah, that makes more sense.
The cool
though.
thing about needling is it's such a quick treatment.
Yeah.
It's like 5-10. Well, I do for 2 minutes sometimes. Like you just needle the sensitized or
Yeah.
increased tone muscle,
Yeah.
and then it kind of just like relaxes after the needling.
Yeah. So you must do that a lot then for your low back pain.
For back pain, I do it. I did it on someone's adductors today.
Okay.
Someone's knee.
Yeah.
I did some cervical stuff.
Okay. Yeah, like
I don't-
suboccipital.
Yeah, I don't get a lot of headaches. I did have
Okay.
one this week. TMJ.
Okay. Yes.
I don't do a lot of TMJ, but I'm starting to like
Do
it
you
now.
needle like masseter?
Lateral pterygoid
Okay.
is the
Yeah,
main one.
Okay.
I've from the class that I took,
Gotcha.
and other people that have mentored me told me that lateral pterygoid,
Yeah.
and then masseter are the main ones I would say.
Yes.
The rest are
Sure.
kind of just for show.
Yeah.
It does look cool when everybody's just all needled up and pin cushioned. You put it on Instagram and social
Yeah.
media and people love it. But these three are, I mean, they're very close to something like magic that I've seen because the clicking kind of goes away right away because
Yeah.
it's such a spasmed area.
Uh-huh.
The needling just kind of just releases it.
Yeah.
And I'm like, whoa, that's kind of cool.
Mm-hmm.
But also they have to reinforce it with exercises for the long-term relief, right?
Yes.
I mean, it's all short-term, but reinforcing it with exercises and stretches
Yeah.
is the main benefit.
Do you do any cupping?
Yeah.
Okay.
Yeah, cupping's fine too.
I like cupping. I do cupping more. Well, because I'm not trying needle.
Yeah.
Like I don't have my certification, so I do cupping
Mhm.
if clinics have it. But yeah.
What do you cup the most?
I've done it to the neck. I've done it to low back. I did it to one of my patients she had like a lot of tone and tension here and was getting like ulnar nerve distribution pain, and it like helped her the most out of anything that we've done
Nice.
for that. What else have I done it to? IT band, like
IT band,
lateral
yeah.
knee
Oh,
pain.
that's
Yeah.
that's tough for people. Yeah.
Yeah. Posterior rotator cuff, upper trap.
Nice.
Yeah.
Yeah. Cupping, I have 2 patients that are not good with needles, so I'll just
Yeah,
cup the area.
that's fair.
And they're like, no needles
Yeah.
for me. I'm like, yeah, that's fine. I'll just
Yeah.
cup it. Few minutes left. I wanted to throw out like, what's a good wellness tip that somebody can implement now in their
Ooh.
life?
Yes.
Yeah.
Okay. Well, movement obviously is important,
Mhm.
but outside of movement, in terms of diet, nutrition is so important for our bodies, for tissue healing, for inflammation, for so many things. And so I always say 5 colors a day. So like your plates and your meals should always have like a variety of whole food colors.
Yep.
Not the dyes. But colors. Because every color is associated with different like nutrients and vitamins and minerals and like phytochemicals and stuff.
Yep.
So eat your colors.
Colors.
I am a huge advocate of like sauna and cryotherapy. Both of them.
For sure.
If you have access to that for sauna, then great. For cryotherapy, if you don't have access to the cold plunges or chambers, cold showers,
Yep.
Ice dunking your face in cold water.
I do that every morning.
Yes.
Yeah, I
Oh
love
my
doing
God.
it. I think I texted you that or something. Yeah, I love doing that.
Yes.
Yeah. Mm-hmm.
What other wellness things? I mean, sleep is always
That was
going
gonna
to
be mine.
Crucial.
I had 3
Yeah.
patients today tell me that. I always ask them like, "Hey, did you sleep well last night?" Most of the time they say no. So I'm like, try to get on a consistent sleep
Yeah.
schedule. Sleep is vitally important
Yes.
for recovery, everything.
Totally.
I mean, honestly, anything really.
Yeah. I mean, if you're consistently just getting 5 hours of sleep, like you're missing out
I
on
can't do
so
that.
much recovery for your body, for your brain, for
man,
your like
5
nervous
hours?
system.
I
Yeah.
would die.
No,
I'm way too old for that.
I love a
yeah.
good 9 hours. Like
Mhm.
that's my optimal.
Yeah, 9 hours.
But
yeah,
like
yeah.
during the week, I don't always get
Oh,
that.
5 would kill me.
Yeah.
Oh my
Yeah.
god.
Terrible.
Um,
But I also like. Do you ever talk to your patients about supplements?
sometimes, yeah.
Yeah.
Mhm.
Yeah. I've definitely had a lot of magnesium talks with
Oh,
my patients
yeah.
for like sleep and muscle cramps.
Sure. Yep.
But there's so many different types of magnesium supplements. So You can
We'll
further
save
look
that
into
for the
that.
next time you're in
Yes.
town, which, yeah, we'll talk
Yeah.
about that. Anything else you want to plug? Your podcast?
Yes. So my podcast is called The Physio Diaries. So it is me and Alice, who is external travel physical therapist. And it's pretty much just like the inside scoop into the healthcare and wellness industry. So PT, we've had orthosurgeon on, chiropractor, nurse. Like we're trying to tap into all the fields
Sure, yeah.
and
Why not?
wellness.
As we
So,
should.
yeah.
Social media?
Yes. My social media is Dr. Melanie Ziaziaris, and then my podcast is the Physio Diaries podcast. TikTok, Instagram, podcast also on YouTube, Spotify, Apple. Yeah.
Awesome. Thanks
That's
for the
it.
crossover podcast. Yeah, this is a cool
Yes.
one. My Instagram is at APT Dr. G. If you have any questions on anything pain related, just, message me on there. Thanks for the 100 subscribers on YouTube. I really appreciate it. And we'll catch you guys in the next one. Thank you. Peace.